So this is a big one, right? How can I help you remotely when in-person care didn't work? How is that possible? Well, build a better mousetrap. So in the previous video I had on here, I talked about the IFP system. Now we're going to talk about the process. So integrated functional performance. And integrated functional performance is a testament to the fact that there are principles of recovery, just like there are principles of any sort of result you're seeking in life. And a friend of mine said that we live in a universe of infinite possibilities. Literally anything can happen. It's the probabilities that get you. And I love that statement because what he's saying is that there are ways of addressing our goals in life where we lean into what are very high probability efforts. And by doing that, we secure our chances of success. And recovery is no different. So in the previous video, I talked about the PL process. That's basically the initial element of discovery, where I'm looking for evidence of principles and points of leverage that can serve you. With that, I'm also looking for what's your inspiration, like what is it that truly drives you? What are your challenges? What are the things that could stop us, that could get in your way of getting your result? And so that's the PL process. I mentioned principle stacking. So principle stacking, it's not really a process, it's just what happens. And so I got another quote for you. So methods are many, principles are few. Methods may change, principles never do. Why does that matter? Okay, lots of people have methods, they have protocols, they have pathways that they follow, but from my observation, very few follow principles. And principles, what are principles? Principles are timeless, meaning that they're not going to go away. They're universal, meaning that they apply to everyone, and they're unyielding. If you try to resist a principle, you're not going to succeed very well. And so identifying the principles of a complete recovery is the way to help you. And then how do we put those together is the way to help you actually recover. And so how do we put it together? Well, we use a better paradigm. All right. We want the full picture. And the simplest version of this is I work to get a three-dimensional view of your current experience. And then I work to get a three-dimensional view of where you want to land. What does it look like when everything has come together the way you wanted it to? Those two images together give us a very clear path. And I can get into this, but that also understanding that compelling vision of your ultimate success. There are principles. There's a principle involved in that is showing up over and over again in research. How having that vision, just having that vision, just revisiting that vision, experiencing that emotion of what it feels like to be there, that alone can get you where you want to go. Not because nothing happens, but because you start to subconsciously make decisions that lead you there. So we can get into that if you like sometime. So then there has to be some sort of process involved of applying the techniques of getting you there. And really all that is simple skills. And the method that I use to understand what skill is, I identify a point of leverage. As we're going through this discovery, identify a point of leverage. And a point of leverage is something that we can apply small effort to and get a big result. And I look for what I call low-hanging fruit. So low-hanging fruit, all that means is if you think about like a fruit tree, Low-hanging fruit, if it's ripe, it's right in front of you. It's easy to get to. It's your lowest energy effort. So you're using the least amount of effort to get what it is you want. And it's safe. You don't have to climb the tree at all, right? And so when we're doing things to help you get out of pain, we want to make sure it's safe. We want to make sure it's reliable. We want to make sure it delivers. And so to make sure it delivers, there's a testing method that I use we pre and post test everything to make sure that it's delivering what you're looking for. And and by doing that, it helps me understand how much, how often, and how big of a benefit can we get from this skill. The bigger process, we use a thing called a success compass, and that's so traveling from point A to B in real life is never just a straight line, right? We veer off course, and if we have a good compass, we can course correct. And then we veer off course and we course correct. And it's this process of course correction that eventually gets us to where we want to go. And so we need a compass to do that. I have a super simple form that you fill out periodically that helps keep us on track. And then we have an action planner. So what do I do? Clarity, right? We want to have 100% clarity on what step am I supposed to be taking right now, and how much and how often, and that's in your success action planner. So it's a tool that you get to keep. The last part of this, in terms of like how I get your results from here when you're over there, is just going back to this integrated functional performance system. So if you didn't watch the one on that, what I talk about is these 4 simple steps. I say simple, doesn't mean easy. There's effort involved. Okay. The unload, it's your off button for pain. It's the way to get relief. And we develop a quick relief strategy, but then we turn that into a progressive relief strategy. So it's great to be able to get that symptom to go away, or to at least minimize it briefly. But when we make that happen so that it's lasting, that's when you start to get real capacity. Okay. The rebuild is how you build that capacity. So the rebuild is, there's complicated science involved in it, but again, it leans on principles. Every joint in your body has little muscles that sort of prepare the joint for movement, and then we have bigger muscles that move the body. Once you've had pain or injury, those systems are disconnected. We need to reconnect them. That's the rebuild. The reset. So this isn't for everybody. This part, honestly, like some people are done with the unload. They're like, I'm good. Many people are done once we get the rebuild established. A good number of people want to go further, though. They want to take their body. They're like, I like this system. I like what it's doing for me. I want to keep going. So then we work on the reset. And that's, in a sense, the local area, say your neck hurts. So we do the unload and rebuild for your neck. But now you're like, I want to tie this whole thing together head to toe, because I got bigger things I want to do with my body. Your reset is how we tie things together. And then if you want to go big, you want to do something elite for you or elite for the world, then reconditioning. So we got to take this body that's had this trauma and suffered this sort of impact. We have to unload that impact. We have to rebuild how things work together and reset this whole system. And then the next thing we do is recondition that thing so that you can take it out and do some high performance. There's not a ton of people that want to put in that kind of work, but if you do, I love it. Let's do it. This hopefully helps you understand how I can get results with you from here when you're over there, because it happens all the time.